kidneys to increase the uric acid excretion. And this was the recent question, which is a uricosuric drug. So it is a drug known as probenecid. It is known as probenecid, which is the best drug or the strongest drug, which has an anti-inflammatory action in cases of gout. Strongest, best drug. Very good. It is known as colchicine. Please remember, it is known as colchicine. Okay? Important is, what is the drug which is used in cases of refractory gout? That means we have tried everything. NSAIDs हो गई, colchicine हो गया, allopurinol हो गया. Very good. In refractory gout, we have to give enzymes usually, uricase enzyme analogs. That is drugs like RAS uricase, or it can also be called as pegloticase. These are injectable agents, and this have been asked as well. Okay? So RAS uricase or pegloticase are usually preferred in a case of refractory gout. What do I mean by refractory gout? The gout which is not responding to any other drug. That is a refractory gout. ठीक है? याद रखना है बात. मैंने क्या बोला, गाउट और माइग्रेन रट्टे हुए होने चाहिए तुम्हें वर्ड टू वर्ड. नो इश्यूज विद दिस एनीबॉडी? दैट्स इंपॉर्टेंट. Question number 42, guys. A female patient was on warfarin therapy after prosthetic valve implantation. She conceived, matlab she got pregnant. So what advice will you give regarding the use of drug in early pregnancy? Early pregnancy, matlab they are talking about the first trimester of pregnancy. And we know that warfarin is usually a teratogenic drug that is known to cause fetal warfarin syndrome. Okay, so due to that, we need to change warfarin from a warfarin to a safer drug that is nothing else but heparin. So change warfarin to heparin should be your answer, option number B. Important is heparin, why it is not preferred usually? Because it is a injectable drug. It is not a oral drug, whereas warfarin is a oral drug. Normally, if they ask you guys, anticoagulant of choice in maintenance phase, anticoagulant of choice in maintenance phase, answer is warfarin. मैं pregnancy की बात नहीं कर रहा हूँ. Normally, anticoagulant of choice in maintenance phase, answer should be warfarin. Warfarin inhibits vitamin K. It is a vitamin K antagonist. So therefore, all the clotting factors activated by vitamin K will be inhibited by warfarin. That is clotting factor 2, 7, 9 and 10. 2 plus 7 is equal to 9 and last one is 10. See, these clotting factors will also be inhibited by warfarin. No issues with this, anybody? Important. Whereas if they ask you in cases of emergency, what is the anticoagulant of choice? Then your answer should be heparin. Because in emergency, we need a faster drug because warfarin takes 5 days to act. No issues with this, anybody? But in cases of pregnancy, the safer drug is heparin. Therefore, in first trimester or during or at term, definitely, we will change the patient to heparin. But we can continue warfarin in the second or the third trimester of pregnancy. Only in the first trimester or during term. During term Q, because when the patient will come to delivery, if she is on warfarin therapy, she will have high chances of PPH, postpartum hemorrhage. That's why we will change usually before delivery to heparin. Important is, please remember, if they say that the patient comes to you in labor and she is on warfarin therapy, आप क्या करोगे? If she comes to you in labor and the patient is on warfarin therapy, अब give vitamin K to the patient. उसके साथ साथ continue या discontinue warfarin. Continue warfarin and mode of delivery should be LSCS. The reason is to minimize bleeding because otherwise there will be high chances of PPH. If you go for a normal vaginal delivery, the bleeding will not stop. Okay, so it's better to perform a LSCS. ये previous year NEET PG का question है, ठीक है? So be aware of this as well. Next is question number 40. ये बता देना बस. The drug of choice for warfarin toxicity, vitamin K. Bleeding tendency अगर हो, मतलब patient bleed कर सकता है, then vitamin K can be given. But अगर patient bleed कर रहा है already, then what should be given? 4-factor complex. In cases of warfarin toxicity, okay, then definitely you need to give 4-factor complex, also known as prothrombin complex. That contains only these 4 clotting factors, 2, 7, 9 and 10. If that is not an option, the second best answer will be richest source of all clotting factors. Answer is FFP, that is fresh frozen plasma. Best answer is FFC, not an option. Go for FFP. ठीक है, drug of choice for heparin toxicity. Very good. So for heparin toxicity, the drug of choice is protamine sulfate usually. No issues with this, anybody? These are the important questions which have been asked. Chalo. Moving further, question number 43. Which of the following drug is preferred drug for closure of patent ductus arteriosus in a preterm baby? Answer should be, usually we know that the ductus arteriosus which is there, it is a connection between the aorta and the pulmonary artery. Okay. Important is the blood cannot go into the lungs because the lungs are collapsed in the fetal life. Therefore, all that blood should enter into the aorta via this ductus arteriosus. That is the reason the ductus arteriosus should remain open, and they are kept open with the help of prostaglandins. So prostaglandins are responsible for patency. तो अगर अपने को बंद करने हैं तो we need to give prostaglandin inhibitors, and prostaglandin inhibitors are usually drugs like NSAIDs, that is non-steroidal anti-inflammatory drugs itself, and the drugs which are given is usually indomethacin or ibuprofen. Important is indomethacin was earlier given, but the better and the safer drug than indomethacin is ibuprofen. That is the reason why ibuprofen should be the better drug and the drug of choice for closure of ductus arteriosus in a premature infant. No issues with this, anybody? That's important. कोई दिक्कत नहीं है इसमें, समझ गए basically, that's important. Okay. Now important, phospholipids are broken down to arachidonic acid by the enzyme known as phospholipase A2, and the drug which inhibits phospholipase A2 is known as steroids, and therefore steroids are known for anti-inflammatory action. Please remember, arachidonic acid can be converted into prostaglandins or leukotrienes. They will be converted to prostaglandins by COX enzyme, cyclooxygenase, and they will be converted to leukotriene by LOX enzyme, that is lipooxygenase. In cases of bronchial asthma, the 5-lipoxygenase inhibitor that we give is known as xylutone. That is again a previous year question. And the monoclonal antibody that we give in asthma is known as omalizumab. Shabash. It is known as omalizumab. Okay? Important. Whereas the COX inhibitors that we usually give, these are nothing else but your NSAIDs itself, non-steroidal anti-inflammatory drugs. Okay, prostaglandin will be further converted into one substance that is called as thromboxane A2. It is responsible for platelet aggregation or platelet disaggregation. It is causing platelet aggregation. Therefore, a drug which will inhibit thromboxane A2 will cause platelet disaggregation, and that antiplatelet drug is known as aspirin. Very good. So aspirin inhibits which enzyme? It inhibits cyclooxygenase. Reversible or irreversible inhibitor? It is an irreversible inhibitor of cyclooxygenase enzyme. कोई दिक्कत नहीं है. This is important to be remembered. Question number 44. A patient presented with nausea, vomiting, abdominal cramps, and diarrhea. Following trophozoite was observed in the stool examination under microscope in the image. Positive organism. Very good. The answer to this question here, the patient is having a protozoal infection in the intestine, and that is caused by a protozoa known as Giardia lamblia. Why? Because the trophozoite which is seen under microscope has which characteristic appearance, guys? It is known as the tear drop appearance. Appearance की बात चल रही है. Also known as tennis racket appearance. Also known as monkey face appearance. Okay, and this tennis racket appearance, monkey face appearance, or the teardrop appearance. It is due to which form? It is due to the it is usually due to the quadrinucleate cyst of the Giardia lamblia. Please remember this. No issues with this, anybody? It is due to ingestion of contaminated water and contaminated food. That is, it is a fecal-oral disease itself. No issues with this. If they ask you in a patient of HIV positive patient, what is the cause of diarrhea? Very good. In a HIV positive patient, if they talk about diarrhea, your answer should be more likely about Cryptosporidium parvum. And this is the oocyst of Cryptosporidium parvum, 2 to 6 microns in size. Okay, small oocyst which are seen. So याद रखना कम से कम Cryptosporidium parvum is the cause of diarrhea in which patient? HIV positive patient. Important question. Next is ETEC, enterotoxigenic E. coli. T for toxigenic. It is also the most common cause of which diarrhea? Traveler's diarrhea. That has been asked us again. Okay? So enterotoxigenic E. coli, also known as ETEC, is the most common cause of traveler's diarrhea. No issues with this, anybody? And entamoeba histolytica will cause amoebiasis. First, it will cause intestinal amoebiasis, which ulcers will be formed. Flask-shaped ulcers. Then it will spread to the liver, causing amoebic liver abscess. Please remember. Which type of pus will be seen? Chocolate or anchovy sauce pus will be seen. Chalo. Question number 45. A 23-year-old woman presented to the emergency room with profound paresthesia on dorsum of the hand with weakness and inability to extend the wrist. She is not able to extend the wrist definitely. The day prior, she was intoxicated and slept in an uncomfortable posture on a sofa bed. What is the root value of the nerve? What is the nerve affected? So definitely, she might have slept in this position when her her axilla was compressed in the armchair usually, and that has caused what? Saturday night palsy, also known as honeymoon palsy. Okay, so Saturday night palsy, honeymoon palsy usually. It is compression of which nerve? Radial nerve. Radial nerve is known to supply the extensor aspect of arm as well as forearm. It gives cutaneous or sensory innervation on the dorsum of hand. Which fingers? Medial 1.5 or lateral 3.5? Usually the lateral 3.5 fingers on the dorsum of the hand. Yaad rakhna. But the tips are again supplied by the median nerve itself. It is not by the radial nerve. And as radial nerve supplies the posterior aspect, in the posterior aspect of arm and forearm, we have extensor muscles or flexor muscles. Extensor. So definitely, if the injury is there, the patient is not able to extend the wrist. This is what is called as wrist drop. So usually patient suffers from wrist drop. What is the classical splint which is given known as? So this is called as the cock-up splint. As you can see, the patient can perform a movement with this cock-up splint. Therefore, it is called as dynamic cock-up splint. So cock-up splint is given for which nerve injury? Radial nerve injury. What is the radial nerve root value? C5 to T1, C5, C6, C7, C8, and T1. That is the same root value of your brachial plexus also. Same root value is of median nerve also. Very good. What is the root value of ulnar nerve? So usually it is C7, C8 and T1. That is the root value of your ulnar nerve. Please remember. Okay. Now important is if there is a median nerve injury, so the patient will have which kind of thumb deformity? Ape thumb deformity. The thumb will come to lie in the same plane as all other fingers, known as which thumb deformity? Ape thumb deformity. Then when we ask the patient to make a fist, the patient will have a which sign? Pointing index sign. Apart from that, the patient kind of a hand known as benediction hand deformity, also known as Pope's hand deformity. All of these are due to median nerve injury. Please remember this. Okay? Usually, median nerve injury occurs in which syndrome? Carpal tunnel syndrome. That's important to be remembered. Okay? Whereas in Guillen's canal syndrome, which nerve injury usually occurs? Ulnar nerve. Because Guillen's canal में से क्या pass होती है? Ulnar nerve. And ulnar nerve region causes complete or partial claw hand. Partial claw hand. Complete claw hand is due to median plus ulnar nerve injury. Okay? And wrist drop, as I've told you, due to radial nerve injury. Then the patient will also have foot drop. The patient is not able to perform dorsiflexion in foot. That is due to, very good, common peroneal nerve injury. And common peroneal nerve injury की वजह से the patient has foot drop. And the splint which is used is known as foot drop splint, also known as AFO, that is ankle foot orthosis. Okay, so that's the important thing. No issues with this, anybody? So please remember these are the most important things. C5, C6, I've told you it is the root value of axillary nerve. Axillary nerve, apart from causing paralysis of which muscle? Sensations from here. That is with sign? Regimental badge sign. That is also seen in axillary nerve injury. Axillary nerve injury is common in fracture of surgical neck of humerus. Fracture of shaft of humerus causes radial nerve injury. Condyle causes Ulnar nerve injury. Cubital tunnel syndrome causes ulnar nerve injury. ठीक है, cubital fossa, then median and renal. Cubital tunnel answer should be ulnar nerve injury. ठीक है, अच्छे से याद रखना. Question number 46. All of the following are contents of inguinal canal except. तो इम्पोर्टेंट है, याद रखना. मैंने ऑलरेडी बोला एनाटॉमी ऑफ इंग्वाइनल कैनाल इज वेरी मच इंपॉर्टेंट. ठीक है, इंग्वाइनल कैनाल एक्सटेंड्स फ्रॉम द एंटीरियर सुपीरियर iliac spine to the pubic tubercle. It starts with the deep inguinal ring to the superficial inguinal ring. Deep inguinal ring is a defect in fascia transversalis, and a superficial inguinal ring is a defect in external oblique aponeurosis. The roof is the mnemonic is malt. ठीक है, so roof is formed by muscle. Which muscle? Transversus abdominis and internal oblique muscle. They form the roof of inguinal canal. The anterior wall, A stands for aponeurosis. So anterior wall of inguinal canal is formed by external oblique aponeurosis. Then the floor of inguinal canal, L stands for ligaments. Which ligaments? Main is the inguinal ligament and second is the lacunar ligament. They form the floor of the inguinal canal. And lastly, posterior wall. T stands for tendon usually. Which tendon? Conjoined tendon. Okay, please remember. Okay, along with that, fascia transversalis. They form the posterior wall of the inguinal canal. What are the structures which pass in the inguinal canal? Please remember. Sorry. In males, usually, what are the structures in the inguinal canal? Anybody? One is definitely the spermatic cord. In females, what is the main structure? Round ligament. And round ligament is known to maintain the normal axis of the uterus. What is the normal axis of uterus? Anti-verted and anti-flexed. Okay? So that is maintained by the round ligament itself. Along with that, definitely, apart from spermatic cord in males and round ligament in females, what are the other nerves which pass? It is the ilio-inguinal nerve which passes. Therefore, in case of hernioplasty or hernia repair surgery, the most common nerve injured in open hernia surgery, answer is ilio-inguinal nerve. Second nerve which passes is the genital branch of genitofemoral nerve. Okay, because genital branch will supply the pelvic organs or the genital organ. Therefore, it has to come medially. Femoral branch तो सीधे सीधे नीचे जाएगी ना भाई, तो वो inguinal canal से जाएगी क्यों? Basic है. So therefore, the femoral branch of genitofemoral nerve is not a part or not a content of the inguinal canal itself. ठीक है? तो दो nerves pass होती है. Spermatic cord usually, what is present inside the spermatic cord? Ductus deferens, also known as the vas deferens. Along with that, we have fascia. Which fascia? Cremasteric fascia. We have muscles, that is cremasteric muscle. Internal spermatic fascia, external spermatic fascia, ये भी होता है. Sorry, pampiniform plexus of testicular veins, testicular artery, ये सब चीजें पास होती है. ठीक है, तो spermatic cord as a whole you can remember. ठीक है, so that's easy. No issues with this, anybody? So now, genital branch of genitofemoral nerve passes. Spermatic cord in males pass. Round ligament in females pass. What does not pass is the femoral branch of genitofemoral nerve. ठीक है? This genitofemoral nerve is responsible for which reflex, anybody? Previous year question है. Genitofemoral nerve is responsible for the cremasteric reflex. That means when you strike the inner part of the thigh, the testis will get elevated usually. Okay, the afferent branch is known as the femoral branch, and the efferent branch is known as the genital branch. ठीक है? Root value of genitofemoral nerve L1 and L2. Please remember. No issues with this, anybody? That's important. So it is responsible for the cremasteric reflex. Question है ये. Cremasteric muscles are present in the testis, भाई. ठीक है? Moving further, question number 47. An elderly male with history of hemorrhagic stroke a month prior presents to you with severe spontaneous intractable pain. अचानक से पेन शुरू होता है, बहुत ज्यादा सीवियर पेन होता है, कहीं भी होता है बॉडी में. Allodynia, that means even touch can cause pain in the patient. तुम बस टच कर रहे हो तो भी पेशेंट में पेन हो रहा है. A non-painful stimulus is causing pain, that is allodynia. Then there is ataxia, that is incoordination. Dysesthesia. एस्थेशिया का मतलब होता है सेंसेशन. डिसएस्थेशिया मतलब abnormal sensation with altered temperature sensation. Temperature sensation is the responsibility of hypothalamus. ठीक है? The most probable diagnosis from the above given finding is very good. It is a case of Dejerine-Roussy syndrome, also known as thalamic pain syndrome. Q. Because the patient had a hemorrhagic stroke at the level of thalamus and the hypothalamus, due to which there is decreased blood supply to the thalamus and the hypothalamus, due to which the patient is experiencing all these symptoms. There is severe, sudden, intractable pain anywhere in the body. Along with that, there are abnormal sensation and altered temperature sensation in the body. That is called as thalamic pain syndrome or Deferine-Towsey syndrome. Next important is, what is phantom pain? After amputation, still pain, मतलब उसका pain है. That is what is called as phantom pain syndrome. Please remember that. ठीक है? So that is important. You need to remember that. ठीक है? Next is syringomyelia. Syringomyelia is what? Cavitation. Syrinx is nothing but cavity. Okay, so there is cavitation usually in the spinal cord, and the most common cause of this is TB. Very good. तो syringomyelia, mylia का मतलब होता है spinal cord, syrinx का मतलब होता है cavity. There is a cavity which is formed inside the spinal cord, and the reason is TB usually. Due to that, there is damage to the spinal cord, and depending on the location where the cavity is formed, the patient will develop the symptoms. Okay, but phantom pain is important because it has been asked earlier as well. Phantom pain is nothing even after amputation of limb. If the patient feels I'm experiencing symptom in that particular limb, if the patient is experiencing pain in that limb, काट चुके हाथ पर तो भी लग रहा है कि इस हाथ में पेन है. ठीक है, so that is what is known as phantom pain syndrome or fake pain syndrome. ठीक है. Question number 48. Which of the following diagrams represent ECF and ICF volume and osmolarities after infusion of 3% NaCl? What are these diagrams known as? चलो, तुम्हारे एग्जाम में इतने कॉमनली रिपीट नहीं होते हैं. Darrow-Yanet diagram. Important is, I hope all of you are quite aware. How much is the total body water, buddy? 60% of body weight. Okay, total body water is 60% of body weight, out of which 2/3 is ICF, that is intracellular fluid, and 1/3 is ECF, that is extracellular fluid. Now, ECF or extracellular fluid can be of two types. That the one which is present in the vessel, it is called as plasma. The one which is present in between cells or tissues, that is called as interstitial fluid. No issues with this, anybody? Please remember this. Okay? Normally, usually in a 70 kg patient, okay, how much is the total body water? 42 liters. Okay, so ICF usually becomes 28 liters and ECF usually becomes 14 liters. Okay, so that happens. Important is, osmolarity का मतलब क्या होता है? Concentration. Osmolarity का मतलब होता है concentration. Okay, volume is the amount of fluid. ठीक है, दो चीजें तो पता है. Now important is, first of all, in these diagrams, see, ये normal diagram है. Okay, y-axis tells you about the concentration of the fluid or the osmolarity of the fluid, whereas x-axis tells you about the volume or the amount of fluid. जो majority part है, वो ECF होगा या ICF होगा? Pink वाला? बच्चों, तुमने खुद ने बोला normally 2/3 ICF होता है. So the pink वाला part should be ICF and the yellow वाला part should be ECF. कोई दिक्कत नहीं है अभी? Important. Now, definitely, if there is gain or loss of fluid, if you are giving some fluid to the patient or the patient is losing some fluid, there will be change in ICF volume or ECF volume. Only ECF volume, तुम दे का रहे हो fluid vessel में, so there will be only change in the ECF volume. Okay, so ECF volume changes whenever there is either gain of fluid or loss of fluid. If there is gain of fluid, ECF volume will increase, and if there is loss of fluid, the ECF volume will decrease. Now, next statement that you need to remember, the ECF osmolality which is there, that is the ECF का जो concentration होता है, it is inversely proportional to the ICF volume. इसका मतलब क्या? जब ECF का concentration या osmolality बढ़ेगी, ICF का volume कम होगा, ICF का volume will decrease. ठीक है? So that is what is basically we mean. Inversely proportional का होता है जब एक बढ़ता है दूसरा घटेगा. So when ECF osmolarity or concentration will increase, the ICF volume is going to decrease, or vice versa. When ECF concentration will decrease, ICF volume will increase. Important is, now first of all, we can give three kind of fluids to the patient. One fluid which has exact same concentration that has blood or plasma. That will be called as isotonic fluid. Tonic का मतलब होता है concentration, iso का मतलब होता है same. So isotonic fluid definitely is the fluid having same concentration as that of plasma usually. If you give this fluid, ECF volume will, you are giving this fluid. So ECF volume will increase or decrease? ECF volume will increase. Will there be any change in ECF concentration or ECF osmolarity? No, क्योंकि तुम कैसा fluid दे रहे हो? Isotonic. Therefore, the ECF osmolarity remains same. And if ECF osmolarity remains same, will ICF volume change? ICF volume also remains easy. Next is hypotonic fluid. Hypotonic, that means the fluid is having concentration less than that of the plasma. Okay, less concentrated fluid. If you are giving fluid again, if you are giving fluid, so ECF volume is going to increase. But this time you are giving hypotonic fluid. That means a fluid having less concentration. So the ECF volume is going to decrease. And due to that reason, as they are inversely proportional, ICF volume is going to increase. तो जब भी ECF वॉल्यूम घटेगा ICF वॉल्यूम क्या हो जाएगा? बढ़ जाएगा. They are inversely proportional to one another. Last is hypertonic fluid. Hypertonic means the fluid which is having more concentration as compared to plasma. If you are giving hypertonic fluid, again fluid दे रहे हो, so ECF volume should increase. Now, as you are giving concentrated fluid, so ECF concentration or ECF osmolarity should increase or decrease? As you are giving concentrated fluid, the osmolarity should increase. And as it is inversely proportional to ICF volume, if ECF osmolarity is increasing, ICF volume should, ठीक है? Now we are talking about the last one, क्योंकि ये हमारा question है. What has been given in the question? 3% NaCl. Normal saline is 0.9%. 3% NaCl is hypotonic, hypertonic. Hypertonic. So whenever we are giving hypertonic fluid, what should happen to the ECF volume? Should increase. ECF पीला वाला है. So ECF volume should increase. Is it increasing? Yes, definitely. ठीक है? So ECF volume is increasing in both these conditions. Okay, even here also. Important is now, as we are giving hypertonic fluid, what should happen to the ECF osmolarity? ECF osmolarity should increase. कहाँ दिखेगी वो y axis पे दिखेगी ना. तो ECF osmolarity is increasing. इसमें ECF osmolarity change हो रही है क्या? नहीं. So this is which fluid? Isotonic fluid. इसमें बस gain of fluid हो रहा है. ECF osmolarity remains same. ठीक है? Next is, यहाँ पे क्या हो रहा है? ECF volume is increasing, whereas ECF osmolarity is also increasing. क्यों? Volume क्यों बढ़ रहा है? Because we are giving fluid. But कैसा fluid दे रहे हो तुम? Concentrated या hypertonic fluid. Therefore, the osmolarity is also increasing. And whenever the ECF osmolarity increases, the ICF volume, is it decreasing? Yes. So answer should be option D to this question. This one will be which fluid? Hypotonic. क्यों? क्योंकि ECF volume is increasing, but the concentration is decreasing. And inversely, the ICF volume is increasing. ठीक है? नहीं याद आ रहा, does not matter. ठीक है, rarely question आता है, but easy है वैसे, एक बार देख लोगे हो जाएगा. Question number 49. 54-year-old man comes to his primary care clinician complaining of erectile dysfunction. He is given a prescription of sildenafil. Which drug is sildenafil? Anybody? Phosphodiesterase 5 inhibitor. And follow-up reports that his ability to sustain an erection has markedly improved with this treatment. The action of which of the vasoactive mediators would primarily be prolonged in this patient? So usually we know, see, normally penile erection क्यों होता है? Because there is vasodilatation in the penis. Now usually, and it is due to the mediator known as nitric oxide. Previous year question, सरकारी है. Nitric oxide is derived from which amino acid? Very good. It is derived from L-arginine. Okay, nitric oxide is derived from which amino acid? L-arginine. Nitric oxide usually is prepared with the help of an enzyme known as NOS, that is nitric oxide synthase, which is present in the endothelial cells. Once this nitric oxide is synthesized or it is formed, it will activate an enzyme known as guanylate cyclase. Guanylate cyclase converts GTP to cyclic GMP. Cyclic GMP is a secondary messenger, and this cyclic GMP causes smooth muscle relaxation, causing vasodilatation that leads to penile erection. Once the work of cyclic GMP is done, उसको रख के क्या फायदा है क्या? नहीं. Otherwise, the patient will have priapism. Therefore, this cyclic GMP, once its work is done, it should be degraded, and it will be degraded back into GMP with the help of an enzyme known as phosphodiesterase 5. But हमें क्या चाहिए? The patient wants a penile erection. If the patient wants a penile erection, that means cyclic GMP should be more. Okay, it should stay over there for a longer period of time. Therefore, we will block what? We'll block the phosphodiesterase 5 enzyme. Okay, we will stop the degradation of cyclic GMP. If we stop the degradation of cyclic GMP, the level of cyclic GMP is going to increase. And if the level of cyclic GMP increases, there will be more vasodilation causing penile erection. Therefore, these drugs are used for, these usually are used for in cases of, किसके लिए यूज करते हो तुम लोग? Erectile dysfunction. Important is longest acting phosphodiesterase 5 inhibitor. Previous year question होना स्टार डाला fill usually. ठीक है? No issues with this anybody? तो अब किसका एक्शन प्रोलॉन्ग कर रहा है? Which chemical mediator? Nitric oxide का. Okay? So please remember, sildenafil or any phosphodiesterase 5 inhibitor is known to increase the action of nitric oxide because it does not degrade the cyclic. ठीक है? So it increases the nitric oxide. ये nitric oxide का क्वेश्चन नाइट्रेट्स में से भी आता है and very important question, repeated multiple number of times. ठीक है? क्वेश्चन नंबर यूजुअली ग्यूएनुलेट साइक्लेज भी पूछा गया, साइक्लिक जीएमपी भी पूछा गया, नाइट्रिक ऑक्साइड भी पूछा गया. Everything has been asked from pharmacology. Question number 50. A patient suffering from hormone deficiency presents with polyuria, that is increased urine output along with hypotonic urine. Hypotonic का मतलब more concentration or less concentration? Less concentration. Okay, so urine is having less concentration definitely. And there is polydipsia, that is increased thirst. Which statements about the given hormone are true? Which is this hormone anybody? कि जिसकी deficiency causes polyuria, hypotonic urine, polydipsia. ADH. ADH deficiency causes a condition known as ADA nahi re, ADH. It is diabetes insipidus. Please remember, ADH deficiency leads to diabetes insipidus. Diabetes क्यों बोला जाता है? Because the patient has polyuria, polydipsia. Okay, क्या करता है? Normally ADH का काम बताओ मुझे. ADH is secreted by antidiuretic hormone. Important, ADH is secreted by posterior pituitary, also known as neurohypophysis. But is it synthesized by posterior pituitary? No. Posterior pituitary के hormones दो होते हैं. One is antidiuretic hormone, also known as vasopressin, and second is oxytocin. These are secreted or these are released by posterior pituitary, but they are synthesized by hypothalamus. Okay, so usually, so it is synthesized by hypothalamus and released by posterior pituitary. क्या करता है उसके बाद? Antidiuretic hormone or vasopressin goes and acts on the kidneys usually, and in kidneys it causes what? It causes reabsorption of only water. It does not cause reabsorption of sodium. That's the important thing. Okay, usually हम क्या सुनते हैं कि sodium and water. इस बार नहीं होता है. ADH only causes reabsorption of water, not sodium. It causes loss of sodium. ठीक है? Please remember that. No issues with this. And it is also known to cause vasoconstriction. Okay, no issues with this anybody? So that's the important. So it will help in increasing BP or decreasing BP. It is causing retention of water. Na? More and more water is kept inside body. So volume of blood will increase. So blood pressure of the patient is going to increase. Vasoconstriction will increase peripheral vascular resistance, again increasing the blood pressure. So blood pressure बढ़ाने का काम करता है. Now if it is retaining a lot of water in the body, plasma will get concentrated or plasma will get diluted. Plasma का क्या होगा? बहुत ज्यादा पानी आ गया plasma में. Plasma will get diluted. And what will happen to the urine? Urine will have less water or more water now? Reabsorption of water is there, which is going into plasma. Therefore, plasma is getting diluted. But urine will have less water because all the water from urine is reabsorbed. As urine is having less water, urine will get concentrated. Okay, urine will get concentrated. So it is having opposite action on plasma and urine. Okay? No issues with this anybody? So in a case of diabetes insipidus, there is deficiency of antidiuretic hormone. All that water will be excrete. That's the reason why patient has polyuria. And as there is polyuria, therefore there is increased thirst. Therefore, the patient has polydipsia. Okay, and as more and more water is going into the urine will be concentrated or diluted? Diluted. Therefore, it is a hypotonic. That is diabetes insipidus for all of you. Okay? Chalo. Physio ka question है, it is synthesized solely from paraventricular nucleus? No. It is synthesized from paraventricular nucleus, but also from supraoptic nucleus as well. Okay? Within the hypothalamus. It acts via the V1A receptors to cause vasoconstriction. Yes, true statements. The hormone has opposite effects on volume and osmolarity. Yes, क्योंकि अगर वो volume बढ़ाएगा, concentration या osmolarity कम हो जाएगी. Right? So that's the basic. It has opposite actions on volume and osmolarity. It is secreted by neurohypophysis. I've told you, neurohypophysis is nothing but posterior pituitary. It is secreted by it. So answer should be option D. 2, 3 and 4 are the true statement. 1 is not a true statement. याद रखना, जहां solely, absolutely, exactly ये चीजें लिखी हो ना, यूजुअली ये रॉन्ग स्टेटमेंट, यूजुअली ये रॉन्ग स्टेटमेंट होती है, क्योंकि इतना श्योर शॉट कुछ नहीं होता मेडिसिन में. दैट्स द बेसिक. ठीक है. क्वेश्चन नंबर 51. अ पेशेंट सफरिंग फ्रॉम मेंटल रिटार्डेशन, कोरिया ऑथियोटोसिस. कोरिया इज व्हाट? डिस्टल fast movements. Okay, distal fast purposeless movements are called as chorea, and proximal fast purposeless, distal slow purposeless movements, are called as athiotosis. ठीक है, तो याद रख लो, chorea is nothing but distal fast purposeless movements, and distal slow purposeless movements will be called as athiotosis. Question यहाँ आ चुका है तुम्हारे एग्जाम में, ये जल्दी से बता देना. Chorea is due to damage to which part of the brain? Very good. Chorea is due to damage to the caudate nucleus. Then athiotosis is due to damage to the globus pallidus, and lastly hemibalismus. Hemibalismus is distal as well as proximal movement. Okay, so that is hemibalismus. Hemibalismus is due to damage to, अब जो बोल रहे थे बोलो, subthalamic nucleus. Please remember. ठीक है. So chorea is due to damage to nucleus. Athiotosis is due to damage to globus pallidus, and hemibalismus damage to subthalamic nucleus. Any mistake in this questions now onwards. ठीक है. So the patient is having chorioathetosis, spastic cerebral palsy has developed, and aggressive self-mutilating behavior. Self-mutilating का मतलब self-harm behavior is there. The patient will bite his own lips or own fingers. The enzyme deficient in this patient is very good. Provisional diagnosis क्या है? Lesch-Nyhan syndrome. Important. Lesch-Nyhan syndrome is due to which enzyme deficiency? HGPRT. That is hypoxanthine phosphoribosyl transferase enzyme deficiency. Complete or partial deficiency? Complete deficiency of HGPRT, because partial deficiency causes Kelly-Siegmiller syndrome. Important. Lesch-Nyhan syndrome mein, what are the characteristic feature? Patient develops hyperuricemia, that is gout. Along with that, the patient will have self-harm or self-mutilating behavior, and the patient will have mental retardation. तीन चीजों से डायग्नोसिस कर लो, hyperuricemia और gout. Second is self-harm or self-mutilating behavior, and third is intellectual disability or mental retardation. That is Lesch-Nyhan syndrome. Important question, previous year FMG. Which pattern of inheritance is followed by Lesch-Nyhan syndrome? Very good. It is X-linked recessive. Lesch-Nyhan syndrome follows X-linked recessive pattern of inheritance. कोई दिक्कत नहीं है इसमें? Okay. So please remember this. Previous year question, straight one liner, बस इतना ही पूछा था. Adenosine deaminase deficiency causes. It is causes SCID, that is known as severe combined immunodeficiency. Okay, so adenosine deaminase deficiency, straight one liner, it causes SCID, severe combined immunodeficiency. Please remember this. No issues with this, anybody? Severe combined immunodeficiency is usually a X-linked recessive condition, but sometimes it can be due to enzyme deficiency known as adenosine deaminase deficiency. कोई दिक्कत नहीं है इसमें. Adenosine deaminase is usually an enzyme which is elevated in which infection? Very good, TB. Okay, in all cases of TB, usually whatever you take, pleural fluid, ascitic fluid, कुछ भी ले लो, you will find elevated levels of adenosine deaminase. So it is a marker of TB usually. Okay? Next important is question number 52. A young patient came with complaints of acute abdominal pain on and off. There is tingling sensation in the limbs and there is weakness of the limbs also. She had a history of eating pain from the walls of a newly built house. Which of the following enzyme defect will be the cause for her condition? Provisional diagnosis. Very good. It is a case of lead poisoning. So usually eating paint will lead to lead poisoning, also known as plumbism, because lead is also known as plumbum. Okay. Lead poisoning is usually seen in painters. Therefore, it is also called as painter's colic because the patient will have colicky abdominal pain. Along with that, the patient will have wrist drop as well as foot drop. Along with that, what is the earliest and the most consistent symptom of lead poisoning? उधर लिख रहा हूं इसका मतलब थोड़ी है. Very good. It is pallor. Earliest and the most consistent sign of lead poisoning should be pallor because it is suggestive of anemia in the patient. Why anemia occurs in lead poisoning or plumbism? Because lead is known to inhibit the enzymes of which pathway? Heme synthesis pathway. Two enzymes of heme synthesis pathway are inhibited by lead. First is known as ALA dehydratase. Okay, and second is known as ferrochelatase. Okay, so these are the two enzymes which are inhibited by lead usually. Okay, usually lead as it causes deficiency of heme in the patient. So hemoglobin bhi kam hoga. Therefore, the patient develops anemia. Which type of anemia is seen in lead poisoning? So usually we see the classical microcytic hypochromic anemia. Cytal mnemonic hai na? So L stands for lead poisoning itself. Along with that, the RBCs will have these blue colored dots known as basophilic stippling. So RBC with blue colored dots is known as basophilic stippling. And the gums will show these blue colored lines known as Burtonian lines. So microcytic hypochromic anemia, Burtonian lines, basophilic stippling, pallor, wrist drop, foot drop, colicky abdominal pain. All of these are features of lead poisoning or plumbism. Okay, the enzymes inhibited are ALA dehydratase or ferrochelatase. No issues with this. As we did not have ferrochelatase, we will have to mark ALA dehydratase. Main enzyme to be marked is ALA dehydratase only. ALA synthase is never blocked by lead poisoning. Please remember this. What is the drug of choice for lead poisoning? Previous year question. Very good. EDTA. Okay, EDTA is the chelating agent of choice for lead poisoning. For copper poisoning or Wilson's disease, what is the drug of choice? D. Penicillamine. Okay, so penicillamine is the drug of choice for copper toxicity or copper poisoning. Iron toxicity. Desferoxamine. आगे है question. चलो. Question number 53. A 37-year-old woman with a history of dyspnea, chronic cough, sputum production, and wheezing dies of respiratory failure following a bout of lobar pneumonia. She was a non-smoker and did not drink alcohol. The lung at autopsy is shown below. Which of the following underlying condition was most likely associated with the pathologic changes shown here? What is seen in the pathologic images? Pass positive diastase resistant granules are usually seen, right? So pass positive diastase resistant granules. Pass positive मतलब pink color का दिखता है, ठीक है? So pass positive diastase resistant granules which are seen, they are usually a characteristic feature in a biopsy of alpha-1 antitrypsin deficiency. जैसे ही वो दिख जाता है, answer should be alpha-1 antitrypsin deficiency. In cases of alpha-1 antitrypsin deficiency, the patient will not only have respiratory symptoms, the patient will also have liver disease as well. Okay, so please remember the patient will also develop hepatitis or cirrhosis also, and the patient can also develop COPD, that is chronic obstructive pulmonary disease, but without smoking. Please remember COPD किसकी वजह से होता है? Smoking. But here the patient without smoking develops COPD. That is the important diagnostic indicator कि patient में alpha-1 antitrypsin deficiency रही होगी. The patient develop recurrent respiratory tract infections like pneumonia, and the patient usually dies of respiratory arrest or COPD. ठीक है? That is important. Cystic fibrosis में, apart from respiratory symptoms, what happens in cystic fibrosis? The mucus becomes very, very thick. And as the mucus becomes thick, the patient develops recurrent respiratory tract infections. Along with that, the pancreatic secretions also become very thick. Therefore, the patient develops malabsorption syndrome. The patient will have carbohydrate as well as fat malabsorption. The patient will have insulin deficiency. Okay. So all of these features. Okay. Here we cannot see any other features as such. Therefore, cystic fibrosis cannot be a cause. In which ways good pasture syndrome can lead to bleeding, that is hemoptysis, bleeding in sputum, and hematuria, that is blood in urine. Both of these features are not seen. Good pasture syndrome is known to involve two organs, lungs and kidneys. Okay? Hypersensitivity pneumonitis usually develops after exposure to some organic dust. Okay? Usually something like moldy hay, silica, asbestos, कुछ भी. उसके बाद the patient develops hypersensitivity pneumonitis. Is there any history of exposure? Question number 54. Which among the following pathways will produce ATP? So now important is यहाँ क्या देखना है कि which among the following pathways does not produce ATP? Option A says, option 1 says alpha oxidation of fatty acid. Does it produce ATP? तुम्हारी बॉडी में बनता होगा, हमारी तो नहीं बनता भाई. Zero ATPs it produces. Next is pentose phosphate pathway, also known as which shunt? HMP shunt, hexose monophosphate shunt. HMP pathway produces how many ATPs? Zero ATPs again. ठीक है? Rappaport loop bearing shunt, RL shunt, occurs in which organ? RL shunt occurs in RBCs, produces how many ATPs? Zero ATPs. ठीक है? There are three pathways of fatty acid oxidation or fatty acid breakdown. One is called as alpha oxidation of fatty acid. Second is called as beta oxidation of fatty acid. Last one is oxidation of very long chain fatty acid. Okay. Important is only one fatty acid oxidation or breakdown produces ATPs, and the major pathway of fatty acid oxidation or breakdown which produces ATPs is beta oxidation of fatty acid, which produces ATPs. Okay, please remember that. So which pathway only produces ATP? Only 4. So answer should be option B. Okay, important is one another pathway, that is oxidation of very long chain fatty acid, also does not produce any ATP. It also produces zero ATPs. तुम बोलोगे फिर इनके काम ही क्या है? Important is alpha oxidation of fatty acid and oxidation of very long chain fatty acid occurs in which organ of your which organelle of the cell? It occurs in the peroxisomes. Please remember, oxidation of very long chain fatty acid and alpha oxidation of fatty acid, both of these occur in the peroxisomes usually. Peroxisomes में कौन सी एंजाइम होती है? Catalase and peroxidase. They are known to neutralize or known to scavenge, eat up the free radicals. Free radicals क्या होता है? जब खाना बनाते हो कचरा रहता है ना तुम्हारे घर में, वैसे ही जब सेल खाना बनाता है उसके घर में भी कचरा बन जाता है. That कचरा, that garbage is free radicals या reactive oxygen species. You need to get rid of the garbage, right? So same way, cell also needs to get rid of the garbage. For that reason, we have peroxisome, which contain catalase or peroxidase, which will help in neutralizing the free radicals. Okay? So that is their function. No issues with this, anybody? So याद रखना है important. RBCs में Rappaport loop bearing shunt क्यों होता है? RL shunt. It is for the production of 2,3-BPG, bisphosphoglycerate. What is the role of this? Normally RBCs में एक ग्लूकोज मॉलिक्यूल से कितने ATP बनते हैं? 2 ATPs. Why? Because RBCs contain no mitochondria. RBCs does not have mitochondria. That is the reason why only 2 ATPs are achieved from one glucose molecule in RBCs. Otherwise, all the other cells will achieve 32 ATPs from one glucose molecule. याद रखना ये बात, ठीक है? But sometimes it even not produce that 2 ATPs also. The basic reason is 2,3-BPG has to be produced. क्यों? क्योंकि 2,3-BPG causes, very good, 2,3-BPG causes oxygen release at the level of cell. ठीक है, इसके लिए 2,3-BPG की जरूरत होती है. It decreases the affinity of hemoglobin to oxygen so that the oxygen can get free and it will go to the tissue. Delivery हो सकती है. ठीक है, so that's the important thing. HMP pathway produces two important products. What are those? NADPH and second is ribose 5 phosphate. Ribose 5 phosphate is the sugar used for शाबाश DNA and RNA synthesis. Okay, तो DNA और RNA synthesis के लिए we need ribose 5 phosphate. तो ये काम होता है HMP का, ATP बनाना नहीं. Second is NADPH. NADH enters into ETC and produces how many ATPs? 2.5. FADH2 enters into ETC and produces 1.5 ATP. But NADPH does not go into ETC and it cannot produce any ATP. Therefore, HMP finally does not give any amount of ATP स्ट्रियो। ठीक है, तो NADPH काम क्या करता है? ये जो हाइड्रोजन है ना इसके पास, ये हाइड्रोजन दान करने का काम करता है। इट इज अ हाइड्रोजन डोनर। वेरेवर हाइड्रोजन विल बी रिक्वायर्ड इन द बॉडी, NADPH will give that hydrogen. Okay, it is used for reductive biosynthesis. No issues with this, anybody? That's important. So which pathways does not produce any ATP? First is alpha oxidation of fatty acid. Second is pentose phosphate pathway, also known as which shunt? HMP shunt. Third is which shunt? RL, that is Rappaport Lubering shunt. And last is oxidation of very long chain fatty acids. Okay? Sure. Question number 55. In an evaluation of a 10-year-old boy who has had recurrent infection since infancy, findings include hepatosplenomegaly, enlargement of liver and spleen, lymph node inflammation, superficial dermatitis resembling eczema, microscopic examination of a series of PBS taken during the course of staphylococcal infection indicates that अब तक जितना भी था लिटरली मतलब नहीं था, इससे तुम्हारा डायग्नोसिस बन सकता है. Bactericidal capacity of the neutrophils is impaired or it is absent. What is bactericidal? Bacteria killing capacity. So the neutrophils have the killing capacity of bacteria, but the bactericidal or the bacteria killing capacity of neutrophils is either impaired or it is completely absent. What is the most likely cause of this child's illness? Very good. What is the provisional diagnosis? Very good. Provisional diagnosis is a condition known as क्या? CGD, chronic granulomatous disease. It is a condition known as chronic granulomatous disease. Okay, important is bactericidal killing, bacterial killing क्या है? दो mechanisms होते हैं. One is oxygen dependent killing. Second is oxygen independent killing. Oxygen independent killing are usually your lysozymes, lactoferrins, and all of that. Oxygen dependent killing is very good. Mediated by which enzyme? NADPH. It is NADPH oxidase MPO halide system, also known as oxygen dependent killing. That is a major pathway for bacterial killing. ठीक है, तो अगर NADPH ऑक्सीडेज एंजाइम डेफिशिएंट होगी तो ऑक्सीजन डिपेंडेंट किलिंग हो पाएगी क्या? नहीं. तो बैक्टीरिया मर पाएगा क्या? नहीं. तो पेशेंट में बार बार क्या होता रहेगा? इन्फेक्शन. That what happens in cases of chronic granulomatous disease. Why it is called as granulomatous? Because there is formation of granulomas in the liver and spleen on biopsy. ठीक है, important is that. Now usually it is which pattern of inheritance? That has been asked. X-linked recessive pattern of inheritance. हर एक कैसे autosomal recessive हो सकता है? It is X-linked recessive pattern of inheritance. Please remember, and it is due to deficiency of which enzyme? NADPH oxidase. So it is due to defect in the enzyme NADPH oxidase. Important is, at least remember, enzyme defect in adenosine deaminase. We have discussed it causes SCID, severe combined immunodeficiency. Whereas developmental defect at pre-beta stage causes, matlab beta cells will not, B lymphocytes will not mature. If the B lymphocytes are not maturing, they will not form plasma cells. And if plasma cells are not formed, antibodies will not be formed. That condition is known as A gamma globulinemia. It causes A gamma globulinemia. Gamma globulins are what? Antibodies ना भाई. Immunoglobulins, gamma globulins are nothing but antibodies. A gamma globulinemia मतलब एंटीबॉडी कम है. क्यों एंटीबॉडी कम है? क्योंकि प्लाज्मा सेल्स नहीं है. प्लाज्मा सेल्स किसके बनते हैं? बी सेल्स से बनते हैं. बी सेल्स मैच्योर हुए क्या? नहीं हुए. That's what. Question number 56. A 6-year-old boy presented with salt and pepper pigmentary skin changes. ठीक है, very characteristic image and finding. And photosensitivity. That means whenever he goes into the sunlight, definitely the rash increases. The lesions appeared since the age of 2 years. General examination showed hyper and hypopigmented areas of skin, mainly on the exposed areas to sun. The child has short stature with mental retardation, dysarthria, and ataxia. What is the likely cause for his diagnosis? Provisional diagnosis, anybody? Very good. If the child is having these multiple hyperpigmented macules or lesions all over the body and they are increasing on exposure to activity is present, it is a condition known as xeroderma pigmentosum. यही बच्चा एग्जाम में आ चुका है. ठीक है, so it is a case of xeroderma pigmentosum. And xeroderma pigmentosum, remember, this is DNA repair defect. Which DNA repair defect causes xeroderma pigmentosum? It is nucleotide excision repair defects. Please remember, the nucleotide excision repair defect causes xeroderma pigmentosum. We know Xeroderma pigmentosum does not only cause a skin rash and photosensitivity, but it also increases the risk of skin cancer or skin malignancies. Okay? Next, if they ask you that mismatch repair gene defect causes, this is also a DNA repair defect. Mismatch repair gene defect causes surgery. क्या चल रहा है? HNPCC previous year question again. 2 बार का क्वेश्चन नहीं है. हेरिडिटरी नॉन पॉलीपोसिस कोलन कैंसर. मैं नहीं बोल रहा तुम जेनेटिक्स के डीप में जाओ, कम से कम रटो तो सही चीज है. जो रटने वाली है वो तो रटो, ये भी हाथ से छोड़ दोगे क्या ऐसे क्वेश्चंस? डायरेक्ट पूछते वो HNPCC इज ड्यू टू विच जीन डिफेक्ट? इट इज मिसमैच रिपेयर जीन डिफेक्ट. डोंट लीव दीज काइंड ऑफ क्वेश्चंस गाइस. ठीक है? So these are HNPCC, hereditary non-polyposis colon cancer, also known as which syndrome? Lynch syndrome. ठीक है? It is due to mismatch repair gene defect. Homologous recombination repair defect causes, very good, Bloom syndrome. And second is, बराबर बोलो, ataxia telangiectasia. Okay, so 2 conditions which are due to homologous recombination repair defect is, at least remember, Bloom syndrome and ataxia telangiectasia. They're not going to go into details. Xeroderma pigmentosum का ही केस पूछते हैं, बाकी किसी का केस नहीं पूछते. Just one-liner questions. ठीक है? So don't leave these ones. Question number 57. A 45-year-old woman develops shortness of breath on exertion, easy fatigue and jaundice. On examination, she is pale. There is palpable spleen but no lymphadenopathy. Her hemoglobin level is 9 grams per deciliter. That means she is having anemia. Any which ways, fatigue and pallor are suggestive of anemia in the patient. Reticulocyte count is 9%. Normal reticulocyte count is less than 2.5%. Normal, it should be less than 2.5%. It is more over here. And direct antibody test is positive. Okay? Which of the following bone marrow findings is likely to be seen in this patient? Provisional diagnosis. She is having anemia, ये सबको पता है. कौन से टाइप का anemia है ये बताओ. If she is having jaundice, please remember, she is having palpable spleen. That means she is having splenomegaly, because more and more RBCs are getting destroyed. As they are getting destroyed, it is which type of anemia, guys? Hemolytic anemia, right? And in which hemolytic anemia में क्या क्या होता है? Hepatosplenomegaly. Along with that, bone marrow expansion usually, ठीक है, causing frontal bossing. Apart from that, reticulocyte count increases. ठीक है? Reticulocyte count usually increases due to ineffective erythropoiesis. So it is a case of hemolytic anemia. The type of hemolytic anemia where direct antibody test is positive, it is the investigation of choice for direct antibody test. Direct antibody test can also be called as direct Coombs test. Very good. And it is the investigation of choice for AIHA, that is autoimmune hemolytic anemia. Direct antibody test is nothing but direct Coombs test. It is the investigation of choice for autoimmune hemolytic anemia. So provisional diagnosis is autoimmune hemolytic anemia in the patient. मतलब antibodies are formed in the patient which are targeting the RBCs and killing the RBCs. ठीक है? So that's the basic reason. Important, on peripheral blood smear in a case of autoimmune hemolytic anemia, what will be seen? You can see the RBCs, they are not having any central pallor. Normally RBCs should have central pallor. बीच में थोड़ी सी सफेद दिखनी चाहिए. दिख रही है कोई भी RBC? No, these are called as spirocytes. Very good. Spirocyte in an adult patient is suggestive of autoimmune hemolytic anemia, but spirocyte in a child is suggestive of hereditary spirocytosis. Very good. No issues with this, anybody? Now, apart from that, what is seen over here? All the RBCs are getting attached to each other. That is called as agglutination. That is known as agglutination of RBC, which is an important feature of autoimmune hemolytic anemia. Classical peripheral blood smear है ये. इसमें difficulty होनी नहीं चाहिए. No issues with this, anybody? It is a case of autoimmune hemolytic anemia now, definitely. So what will be seen? RBCs are getting destroyed. So more and more RBCs will be produced. So अगर more and more RBCs have to be produced, definitely बाकी cells को क्या करेंगे? बाकी सेल का proliferation कम होगा और bone marrow में क्या दिखेगा? बस RBCs ही RBCs दिखेंगी, because we need to compensate. So therefore there should be increased एरिथ्रॉइड इज टू माइलॉइड रेशियो, बिकॉज माइलॉइड लीनिएज विल बी सप्रेस्ड कि भाई तू थोड़ा रुक जा, हमें आरबीसी बना लेते हैं, ठीक है. सो देयरफॉर देयर विल बी मोर एरिथ्रॉइड. मेगालोब्लास्टिक चेंजेस आर यूजुअली ऑन अ पेरिफेरल ब्लड smear. What is seen? Megaloblastic anemia. Very good. First is the teardrop cells. Apart from teardrop cells, macrovalocytes. That means the size of the RBC will increase. Okay. Macrovalocytes along with teardrop cells. And these type of neutrophils, which are having more than 5-lobe nucleus, is known as hyper-segmented neutrophils. These are known as hyper-segmented neutrophils. No issues with this, anybody? Please remember this. ठीक है? कोई दिक्कत नहीं है यहाँ तक. So that's important. Question number 58. Okay. ट्रीटमेंट क्या देते हो ऑटो इम्यून हिमोलिटिक एनीमिया में? ड्रग ऑफ चॉइस बताई दो अभी. ऑटो इम्यून है ना, नाम में ही ऑटो इम्यून. वेरी गुड. स्टेरॉइड्स. ऑटो इम्यून हिमोलिटिक एनीमिया, स्टेरॉइड्स. इट अकर्स इन अ पेशेंट ऑफ एसएलई. स्टेरॉइड्स दिया जाता है. क्वेश्चन नंबर 58. चूज द सीरोलॉजिकल मार्कर्स ऑफ अक्यूट एक्टिव वायरल हेपेटाइटिस बी. जल्दी से करो चलो. इंपॉर्टेंट आर दीज. द फर्स्ट एंटीजन टू अपीयर. आंसर इज HBS antigen. HBS antigen is also known as Australian antigen. It is also known as epidemiological marker. Next, first antibody to appear, anti-HBC antibody. Okay. The last antibody to appear, anti-HBS antibody. तो antigen सबसे पहले HBS, but antibody last is HBS. ठीक है, तो याद रखने के बाद. And HBE is a marker of, HBE antigen is a marker of infectivity or viral replication. Okay. So please remember HBE antigen इसका मतलब होता है अगर HBE antigen positive है, that means the patient is in the active phase of the disease. Virus भी replicate कर रहा है, और अगर virus replicate कर रहा है, that means the disease spread. That means it is a marker of infectivity or viral replication. If I talk about acute infectious also means it can be spread. So acute infectious hepatitis B. If a patient is having hepatitis B infection, HBS antigen will always be positive. Okay. Now he's having acute infection. So anti-HBC antibody can be of two types. It can be IgM and it can be IgG. Acute phase में IgM and chronic phase में patient में क्या है? Acute. So which should be IgM anti-HBC antibody. HBE antigen should be positive or negative? Positive, because they have mentioned infectious, active, ऐसा कुछ भी mention किया हो तो. And anti-HBS antibody should be absent, because अगर वो present होती है, that means the patient is in recovery or convalescence. Chronic hepatitis B, guys. Hepatitis B है तो HBS antigen should be positive. Chronic है तो which anti-HBC antibody? IgG subtype. Now, as they have they mentioned any infective, active वगैरह? No. So HBE antigen should be negative. ठीक है? And definitely as the patient is having infection still, he is not in recovery. So anti-HBS antibody should be negative again. Recovery phase. Now HBS antigen should negative ना, recovery में है patient. तो definitely antigen गायब हो जानी चाहिए और क्या appear होना चाहिए? Antibody आ जानी चाहिए. ठीक है? That means he is in recovery or convalescence. HBE antigen obviously recovery में है तो viral replication हो रहा है क्या? नहीं हो रहा. And anti-HBC antibody, which type of anti-HBC antibody should be there? IgM या IgG? IgG, क्योंकि recovery में, recovery is a long-term condition, so it should be IgG. ठीक है? So please remember, if IgG anti-HBC antibody and anti-HBS antibody दोनों है, तो answer is recovery phase. ठीक है? And last is vaccinated individual. He is vaccinated, he is not having infection, so he has not had an infection. So HBS antigen will be negative. Anti-HBC antibody will be negative. HBE antigen will be negative. What will be positive is only the anti-HBS antibody. So vaccinated. तुम्हें मुझ में कौन सी antibody दिखती है बस? Anti-HBS. तो समझ गए? Only anti-HBS antibody. That means the patient is vaccinated. Anti-HBS antibody along with IgG anti-HBC antibody. That the patient is in recovery or. ठीक है? अब अपने पेशेंट में बताओ. हेपेटाइटिस बी है मतलब HBS antigen should be present. As it is acute condition, so which anti-HBC antibody? IgM anti-HBC antibody. And as it is an active phase, so HBE antigen should be, the answer should be option B for this. हाँ बोलो. एंटी एचबीएस के अगेंस्ट अपन एचबीएस सरफेस एंटीजन के अगेंस्ट अपन एंटीबॉडी देते हैं, ठीक है. यूजुअली द एंटीबॉडीज विच आर फॉर्म्ड आफ्टर वैक्सीनेशन ना, दे आर अगेंस्ट द सरफेस एंटीजन. क्यों? क्योंकि हम वैक्सीन में ही सरफेस एंटीजन देते हैं. वी डू नॉट गिव कोर एंटीजन इन द वैक्सीन इटसेल्फ. तो जो एंटीजन दोगे उसके अगेंस्ट तो एंटीबॉडी बनेगी बस. Question number 59. A patient presented with progressive ascending bilateral weakness, recent question of your exam, which is symmetrical after a bout of Campylobacter gastrointestinal infection 3 weeks prior. The deep tendon reflexes are absent. Neurological examination. Most likely finding is very good. It is a case of GBS, that is Guillain-Barré syndrome. Usually he will give an infection of a history of gastrointestinal infection with Campylobacter jejuni. And after Campylobacter jejuni infection, usually after 2 to 3 weeks or maximum 4 weeks, the patient starts developing paralysis or muscle weakness. Classically, which type of paralysis? Bilateral or unilateral? Bilateral. Symmetrical or asymmetrical? Symmetrical. Ascending or descending? Ascending. Placid or spastic? Placid. That is the tone of the muscle is decreased. Okay, so that is what is seen. Ascending का मतलब बच्चों, it starts from the legs, then it comes into the abdomen, then it spreads to the upper limbs, and finally it involves the face. ठीक है, तो नीचे से ऊपर. ये उल्टा कर दूं मैं. If I say there is a unilateral asymmetrical, ठीक है, unilateral asymmetrical descending placid paralysis starting from below, descending placid paralysis again after a gastrointestinal infection. Very good. It is a case of poliomyelitis. That is how you differentiate. ठीक है. So bilaterally symmetrical ascending placid paralysis after GI infection. Answer is Guillain-Barré syndrome. But unilateral asymmetrical descending placid paralysis after GI infection. Answer is poliomyelitis. No issues with this, anybody? Important is that. ठीक है. Now what is usually Guillain-Barré syndrome is a lower motor neuron lesion or upper motor neuron lesion? Lower motor neuron lesion. कैसे पता चला? Placid paralysis is usually seen. And second important, deep tendon reflexes are absent. That is, areflexia is seen. Whereas in cases of upper motor neuron lesion, the reflexes are exaggerated or they are brisk. Okay? That's the basic difference. Chalo batao. Most likely finding. Option A says Levi bodies on histopathology. Levi bodies on histopathology are seen in cases of Parkinson's disease or Levi body dementia. Okay, so Levi bodies on histopath or biopsy are seen in two conditions. First is Parkinson's disease and second is Levi body dementia. Neurofibrillary plaques and tangles are seen in. We have discussed, they are seen in Alzheimer's disease. Dawson figures on gadolinium enhanced MRI. These are the Dawson figures on gadolinium enhanced MRI. Very good. It is seen in cases of multiple sclerosis. Multiple sclerosis, when these are the characteristic features known as Dawson figures. Okay, so these are seen on gadolinium enhanced MRI. So what is left? Albuminocytological dissociation in CSF analysis. What happens is CSF में अगर देखोगे, in meningitis what happens? Proteins also increase and cells also increase. यहाँ क्या हो जाएगा? Proteins, that is albumin, will increase a lot, but cells will be absolutely okay. Proteins increase a lot, but cells will be absolutely normal. That is the reason why there is albuminocytological dissociation. दोनों नहीं बढ़ रहे एक साथ, ठीक है? So that is what is called as albuminocytological dissociation. That is only predominant increase in the level of proteins, predominantly albumin. No issues with this. That is a hallmark feature of Guillain-Barré syndrome. I am saying hallmark. किसी और में नहीं दिखता है. Please remember this. Important is another question. Most common cranial nerve involved in Guillain-Barré syndrome. Very good. It is the seventh nerve. Rather, I hope all of you are quite aware that Guillain-Barré syndrome causes unilateral facial palsy or bilateral. It is an important cause of bilateral facial palsy. Yes, it is an important cause of bilateral facial palsy. Other causes can be Melkerson-Rosenthal syndrome, sarcoidosis, Lyme's disease. ENT में लिखवाया मैंने. ठीक है? So these are the other causes of bilateral facial nerve palsy. This was the recent NEET PG question in 2022. ठीक है? तो ये दिया हुआ था. Okay, these are the Levi bodies, as you can see, the ones which are having a halo around it. These are seen in Parkinson's disease or Levi body dementia. कोई दिक्कत नहीं है. Treatment बताओ जल्दी से. Very good. IV IGs, that is intravenous immunoglobulins, are the treatment of choice for Guillain-Barré syndrome. Question number 60. A 68-year-old male had a history of pressured speech, flight of ideas, distractibility. Okay, अचानक से उसका जल्दी ध्यान भटक जाता है, that is distractibility. बहुतों का यहाँ भटकता है. ठीक है. Next is delusions. Next is disorganized thinking, for which he was started on risperidone therapy daily. After few months, he started experiencing symptoms like slowness in movements, hypophonia, along with stoop posture and shuffling gait, also known as fascinating gait. The drug most likely used to be used in this patient is provisional diagnosis. Shabash. The cause is, the provisional diagnosis is drug-induced Parkinsonism, because the patient was started on a atypical antipsychotic. तुम बोलोगे सर हमने तो typical antipsychotics का side effect पढ़ा है, drug-induced Parkinsonism. But important is, the among atypical antipsychotics, the one which can cause extrapyramidal side effects or drug-induced Parkinsonism, answer is risperidone. Among atypical, the strongest one, which has a D2 antagonism. What is D2 antagonism? D2 receptor blocking action. Because as it blocks the D2 receptor, dopamine will be decreased. And if there is dopamine deficiency, the patient develops Parkinsonism definitely. Dopamine जब बढ़ता है, तब schizophrenia या psychosis होता है. Dopamine जब कम होता है, तो Parkinsonism होता है patient. That's basic difference. ठीक है? So definitely if a patient is given antipsychotics, mainly typical antipsychotics like haloperidol, fluphenazine, flupentixol, then the patient develops extrapyramidal side effects, also known as movement disorders or drug-induced Parkinsonism. Okay, no issues with this, anybody? That's important. Okay, so what is the drug of choice for drug-induced Parkinsonism? Answer is benzhexol. Another name for this drug is trihexyphenidyl. Please remember this. Okay, pramipexole is the drug of choice of Parkinsonism, usually pramipexole or ropinirole in young patients suffering from Parkinsonism. Elderly patients suffering from Parkinsonism, we give levodopa, carbidopa, and N-capone combination. Why levodopa, carbidopa, and N-capone combination avoided in young patient? Because it causes that on and off phenomena, which is very disturbing in a patient who is working. उसके पेशेंट में तुम ये नहीं बोल सकते कभी देखो साइकोसिस हो जाए, कभी देखो पार्किंसनिज्म हो जाए, ये नहीं चल सकता. That's the reason why levodopa carbidopa, though it is the best drug, it is not given in young patient. It is usually drugs like pramipexole and ropinirole. ठीक है? Question number 61. The CB-NAT cartridge-based nucleic acid amplification test is used for Mycobacterium tuberculosis detection. Has the additional advantage of detection of which of the following? Very good. Not only the CB-NAT, but even the gene expert assay that is performed nowadays. Along with detection of TB, it can also detect rifampicin resistance along with it itself. Okay. If I ask you, what are the screening tests for tuberculosis? It is sputum smear examination, and second is chest X-ray. These are the screening tests used for tuberculosis. Please remember, sputum smear examination. कितने samples लेना है? 2. One is the spot sample and second is the early morning sample. No issues with this, anybody? Please remember this. Okay? What is the stain used for Mycobacterium TB? ZN stain, known as Zeal-Nielsen stain. On Zeal-Nielsen stain, how much acid fast is the Mycobacterium TB? Very good. It is 20% acid fast bacilli. 5% acid fast is Mycobacterium leprae. 1% acid fast is Nocardia. Shabash. No issues with this, anybody? That's important to be remembered. Question number 62. A young medical student while working in HIV ward got pricked accidentally on the finger. Okay, he got pricked accidentally on the finger by a syringe needle, which was used to draw the blood from a patient. Patient's infection status is not known. Okay, which of the following therapeutic interventions will be in the best interest of the student? Default wash wound तो करना ही है, but important is the status of the patient's infection is not known, and a patient of HIV can commonly develop another infection also, and that is hepatitis B, because both are transmitted by either blood route or via sexual route. So if a patient of HIV is there now, there are very high chances that the patient can also have a concomitant or a simultaneous infection of hepatitis B or hepatitis C. That's the reason why we need to start the ART, antiretroviral therapy, And in antiretroviral therapy, what is given? Two NRTIs are started. What are two NRTIs, guys? Nucleoside reverse transcriptase inhibitors plus one NNRTI started. What is one NNRTI? Non-nucleotide reverse transcriptase inhibitors. Or instead of NNRTI, we can also start integrase inhibitors like Gravir drugs. तो यहाँ पे हमने NNRTI की जगह क्या स्टार्ट किया है? Gravir, that is integrase inhibitor, dolutegravir. Along with that, we have started two NRTIs, that is tenofovir and M3 citabin. Okay, no issues with this. NNRTI can be drugs like efavirenz. Okay, and we can also give HBV immunoglobulin because is the status known? No. High risk ना HIV patient में HBV हो सकता है. ठीक है, तो HIV के तुम बचा लोगे, बाकी का क्या? Hepatitis B का क्या? That's the reason if the status is not known, better to give prophylactic immunoglobulin also in the patient. Okay, hepatitis B का vaccine भी दो और hepatitis B के immunoglobulin भी दो patient. Usually it should be started as early as antiretroviral therapy after a needle prick injury should be started as early as 72 hours and it should be continued for a span of 4 weeks. It should be given for a span of 28 days or 4 weeks. जो तुम 6 weeks बोल रहे हो, usually within a span of 6 weeks, you need to give nevirapine prophylaxis or zidovudin prophylaxis to whom? To a newborn who was born to HIV positive mother. So a newborn who is born to HIV positive mother, उसमें best drug to be given is zidovudin, but the most common drug given is nevirapine. सस्ती है, available है, इसलिए. Okay, and it should be given within a span of 6 weeks. That is to prevent mother to child transmission or vertical transmission of HIV infection. No issues with this, anybody? So that's the important thing. Wash the wound with soap and water, वो तो करना ही है, वो तो obvious सी बात है. But more important is this one. ठीक है? Question number 63. A child suffering from leukemia is being given radiation therapy, but the patient experiences excessive vomiting. The drug of choice for radiotherapy induced vomiting is. So, not only radiotherapy induced vomiting, but also chemotherapy induced vomiting, also post-op vomiting. The drug of choice are same, and that is nothing else but 5-HT3 receptor blockers. And these 5-HT3 receptor blockers are drugs like cetron group of drugs, ondansetron, granisetron, palinosetron. Important is longest acting cetron is. ये क्वेश्चन में था तुम्हारे ऑप्शंस में, इट वाज गिवन एज palinosetron. A lot of people were confused, ये उसी ग्रुप की है क्या? उसी ग्रुप की है वो. Longest acting 5-HT3 blocker is palinosetron. Please remember. ठीक है? Neurokinin antagonist or substance P antagonist are drugs like pitant, that is aprepitants or nupitants. These are the drug of choice for late vomiting, that is delayed vomiting, due to which anti-cancer drug? The most emetogenic anti-cancer drug, सबसे ज्यादा vomiting करवाने वाले anti-cancer drug. शाबाश, बराबर. So it is due to delayed drug of choice for delayed vomiting due to cisplatin. Answer is neurokinin antagonist or substance P antagonist like pitants, nupitant or aprepitant usually. Important is most emetogenic. This was previous year question. सबसे ज्यादा vomiting करवाने वाली anti-cancer drug, most emetogenic anti-cancer drug. Answer is cisplatin. Cisplatin is also known to cause autotoxicity. ठीक है? So that's important. Two D2 antagonists which are used for vomiting. जल्दी से. Very good. One is called as metoclopramide and the other is known as domperidone. Important is metoclopramide can cross the blood-brain barrier or not? It can cross the blood-brain barrier and therefore it causes sedation or other side effects. Important is domperidone. Does it cross blood-brain barrier? No. So no other side effects usually. So in levodopa-induced vomiting, drug of choice should be domperidone. Okay, so drug of choice for levodopa-induced vomiting. Answer should be domperidone. Jaldi se. Mountain sickness, drug of choices. Acetazolamide, which is a carbonic anhydrase inhibitor. Morning sickness, drug of choices. Doxylamine, which is a H1 blocker. Next is motion sickness, drug of choices. Hyoscine, also known as scopolamine, which is an anticholinergic or anti-muscarinic drug. कोई दिक्कत नहीं है इसमें. So please remember. Question number 64. On examination of a gunshot wound, stellate margin is visible with burns and blackening inside the wound as given below. What kind of shot is this? So important. If the gun is directly kept on the surface and if you fire, what is going to happen? The wound will not be circular. The wound be usually due to that excessive pressure. The wound will have irregular margins or these kind of stellate margins. So usually contact shot will have a stellate kind of margins. And as it is a contact shot, everything, burn, blackening, tattooing, everything will be present inside the wound. Please remember. If it is a close shot, anybody, close shot kitna hota hai? Within 1 meter. Then definitely what will be present? Burns will be present due to the flame. Second, blackening will be present due to the burnt gunpowder. And tattooing will be present due to the unburnt gunpowder. All of these features, if they are present with a circular wound, then the answer should be close shot. Near shot mein, again the patient will have a circular wound. But what will be present? Usually burning, blackening and tattooing. Most of these features are not present usually. Only a circular wound is seen. ठीक है? These are usually not present. Distant shot में क्या दिखता है? ये देख लो यहाँ पे. Distant shot में क्या दिखता है? Can you see any burns, blackening, tattooing? Nothing is usually seen. Only pellet shots are seen. ठीक है? तो अगर multiple pellet shots are seen, that is called as a distant shot. And if stellate margin along with everything inside the wound is seen, that is called as a contact shot. So answer for this question should be contact shot. जैसे ही stellate margin आता है, answer should be contact shot. ठीक है? Question number 65. Which among the following is true about live vaccine? Now there are two types of vaccine, live vaccine and killed vaccine. Killed vaccine are nothing but inactivated vaccine. Live क्या होती है? Live vaccines को क्या बोलते हैं अपन? Very good. Live attenuated vaccine. Attenuation का मतलब बच्चों, we will decrease the pathogenicity. What is pathogenicity? Disease causing ability. So we will decrease the pathogenicity, but we will maintain the antigenicity. Why? Antigenicity is क्या? The ability to induce immune response, the ability to stimulate antibody production. तो अगर कोई ऑर्गेनिज्म जाके डिसीज करेगा उसको बोला जाएगा पैथोजेनिसिटी. अगर कोई एंटीजन जाके बस एंटीबॉडीज प्रोड्यूस करवाएगा बॉडी में, दैट इज व्हाट इज कॉल्ड एज एंटीजेनिसिटी. वैक्सीन में क्या चाहिए? वी नीड टू मेंटेन एंटीजेनिसिटी, बट वी डू नॉट वांट pathogenicity. Therefore, in live attenuated vaccine, we need to decrease pathogenicity and we need to maintain antigenicity. Therefore, the option D is absolutely wrong. Okay, it is completely ulta. Immunocompromised state does not pose a contraindication to live vaccine. Wrong, because usually immunocompromised state is an absolute contraindication for live attenuated vaccine. Two live vaccines can be administered on same day. Yes, it can be administered on the same day usually. Okay, at different sites. Okay, important. Simultaneous administration of two live vaccines must be done same syringe. No. Same day, different sites, different syringes. That should be important. No issues with this. Okay. Killed vaccines का निमोनिक क्या था? अब killed निमोनिक याद रखो, ये जो भी है तुम्हें ठीक लगता है. I stands for fractionated IPV, that is inactivated polio vaccine. M stands for MCV, that is meningococcal conjugate vaccine. A stands for hepatitis A. Then P stands for pertussis and R stands for rabies. बाकी जो vaccines होती है, they are available. Some vaccines are available in both forms. तो वो इसमें नहीं है. Okay, so that's important. No issues with this. What is the strain of inactivated polio vaccine? Salk. The strain of inactivated polio vaccine is Salk. Please remember that. Question number 66. Identify. अगर तुमने same day पे miss कर दी है, then definitely 4 week gap should be there between two live vaccines. If you have missed it on the same day, आज नहीं दी तो कल नहीं दे सकते फिर, then at least maintain a gap of 4 weeks usually. ठीक है? So that has to be maintained properly. Cholera and yellow fever should not be given together. Why? We need to maintain at least a minimum gap of 3 weeks because एक दूसरे का absorption रोकते हैं. One will inhibit the absorption of another. That's the reason why they should be given at a gap of 3 weeks usually. ठीक है? Identify the correct statement about the distribution pattern given below. Normally, the normal standard distribution is also called as Gaussian distribution. And Gaussian distribution is bilaterally symmetrical or asymmetrical? It is bilaterally symmetrical. Therefore, which kind of curve is formed? Which kind of curve is seen? Bell-shaped curve is seen, na? So here you can see, bacho, this is the average of the mean value. Equal values on right side and equal values on left side are there. Therefore, it is a bilaterally symmetrical graph. This is what is called as a Gaussian distribution or a standard normal distribution. In this kind of a graph, usually, please remember, the mean will be equal to median will be equal to mode. So in a normal standard distribution, mean is equal to median is equal to mode. That is important to be remembered. Plus minus 1 standard deviation covers how much percent data? Straight one liner. 68% data. Plus minus 2 standard deviation covers 95% data. And plus minus 3 standard deviation covers 99.7% data. These are the previous year questions. Jaldi say. Plus minus 1, 68%. Plus minus 2, 95. Plus minus 3, 99.7. No issues with this, anybody? That's important. Now, if I say that some values are more towards right side or some values are more towards left side, then this type will not be a normal standard distribution. This type of distribution will be called as a skewed distribution, right? This will be called as a skewed distribution. If more number of values are towards the right side पे positive values आती है, negative values आती है बच्चों, positive. Therefore, if more number of values are towards the right side, so the longer tail will be towards the right side, and therefore this will be called as with skewed distribution, right skewed distribution, also known as positive skewed distribution, because more number of values are towards the right or towards the positive side of the graph. Therefore, the longer tail is towards the positive or towards the right side of the graph. Okay? Whereas if more number of values are towards the left side or towards the negative side, then this type of distribution will be called as left skewed distribution or a negatively skewed distribution. Jaldi say, in a right skewed distribution or a positively skewed distribution, mean will be more than, median will be more than mode. But in a left skewed or a negative skewed distribution, mean will be less than, median will be less than mode. ठीक है? अपने इमेज में क्या दिया हुआ है? The long tail is towards positive, right side or left side? Left side. So positive या negative side? Negative. Negative में mean सबसे कम, फिर median, फिर mode. Answer should be option A. Question number 67. If the prevalence is very low as compared to the incidence of disease, it implies. सबसे पहले prevalence is what? Prevalence is total number of cases, that is new as well as old cases. What is incidence on the other hand? Incidence is the total number of only new cases. Please remember this. Okay? So that is important. Now usually they are saying the prevalence is very low. याद रखना, what is the relation between prevalence and incidence? Prevalence is equal to incidence into duration. Prevalence is equal to incidence into duration. Now important is, if prevalence is very low as compared to the incidence of the disease, वो क्या बताता है हमें? What does it imply? Prevalence is very low as compared to incidence. Prevalence low है, incidence high है, तो क्या लो होना चाहिए? ड्यूरेशन लो होनी चाहिए. मतलब एक तो डिसीज जल्दी क्योर हो रहा है या डिसीज जल्दी मार रहा है. तो दैट मींस द डिसीज इज आइदर इजीली क्यूरेबल और द डिसीज इज एब्सोल्युटली फेटल. ठीक है? व्हाई? बिकॉज इफ द डिसीज इज इजीली क्यूरेबल और द डिसीज इज फेटल, तो क्या हो जाएगा? एक तो पेशेंट ठीक हो जाएगा या पेशेंट मर जाएगा. तो ड्यूरेशन ऑफ द डिसीज विल बी रिड्यूस्ड. तो नंबर ऑफ ओल्ड केसेस विल बी reduced, and if number of old cases are reduced, definitely what will happen to the prevalence? Prevalence will be reduced. But is there any effect on incidence? No. Number of new cases are occurring by the same rate, so therefore the incidence will be high. Okay? So if the disease is fatal or easily curable, prevalence will be low, but the incidence will be, or incidence will be same. Drug which prevents the disease. These are some important previous year questions. If we have launched a drug in the market which is preventing the disease, which is used as a prophylaxis for the disease, what will be the effect on prevalence and incidence? If it is preventing a disease, number of new cases will decrease. So if number of new cases will decrease, incidence is going to decrease. So incidence is going to decrease. And if incidence decreases, definitely prevalence is also related to it. Number of new cases decrease होंगे तो total number of cases भी क्या हो जाएंगे, कम हो जाएंगे. So prevalence is also going to decrease. Next is drug which cures the disease. ठीक कर देती है patient. So if drug is curing the disease, the duration of the disease is decreased. And if the duration of disease is decreased, what will happen to the prevalence? Prevalence will also decrease. But what will happen to incidence? Nothing. Incidence will remain same because this drug is not preventing the disease. ये बस ठीक करती है. नए नंबर ऑफ केसेस को रोक रही है क्या? नहीं. तो नए नंबर ऑफ केसेस अपने स्पीड पे होते रहेंगे. इट इज ओनली क्यूरिंग द डिसीज. जिनको हो चुका है उनको ठीक करती है. अगर जिनको हो चुका है उनको ठीक कर रही है मतलब ड्यूरेशन ऑफ डिसीज को कम करती है. तो प्रिवेलेंस ऑफ डिसीज या टोटल नंबर ऑफ केसेस को कम करती है. ओल्ड नंबर ऑफ केसेस घटा रही है, न्यू नंबर ऑफ केसेस पे कोई असर नहीं है इस ड्रग का. दैट इज व्हाट वी मीन. लास्ट इज, ये क्वेश्चन 2 या 3 बार रिपीट हुआ है लास्ट वाला. ड्रग विच डज नॉट क्योर द डिसीज ओनली डिक्रीजेस द मोर्टालिटी. वेरी गुड. इट इज नॉट क्यूरिंग द डिसीज बट क्या कर रही है, मोर्टालिटी कम कर रही है. इफ द पेशेंट इज नॉट डाइंग, द पेशेंट इज लिविंग नाउ. इज द डिसीज क्योर्ड? नो. तो पेशेंट इज लिविंग बट द पेशेंट इज लिविंग विथ disease. So the duration of the disease is, and if duration increases, prevalence also increases. What will happen to incidence बच्चों? Incidence पे कोई भी असर होगा क्या? नहीं होगा. ना वो ड्रग प्रिवेंट कर रही है, ना प्रोफाइलैक्सिस है, ना कुछ है. तो incidence will remain. ठीक है? No issues with this. Once go home and revise it, it will be easier. Don't worry about that. Question number 68. A group of 100 individuals has 46% hypertensive individuals. Drug H has been prescribed for the hypertensive individuals, and the prevalence came down to 26% after 2 months of therapy in the same group. Which among the statistical tests will be used for above case? तो जल्दी से, जिसको नहीं पता, there are 2 types of statistical tests. One are parametric, second are non-parametric tests. Parametric tests are used to compare mean value, average value, or standard deviation, whereas that is quantitative data. Whereas non-parametric tests are used to compare percentage or fraction. Okay, non-parametric test. These are very easy question. एक बार ध्यान दे दो, सब समझ में आ जाएगा. कोई बड़ी तोप नहीं है ये चीज. Very easy. People make it complicated for themselves. So non-parametric test, we will compare percentage or fraction usually. Okay, that is a qualitative data. Now, if I am comparing mean or average value, okay, in one group, then the test is called as paired student t-test. Then the test will be called as a paired student t-test. If I'm comparing mean or standard deviation in 2 groups, if I'm comparing it in 2 groups, then it is called as unpaired student t-test. बता देता हूँ example sir, don't worry. Unpaired student t-test. If I'm comparing mean or standard deviation or any average value in more than equal to 3 groups, 3 या 3 से ज़्यादा, very good. It is known as the ANOVA test. If I'm comparing percentage of fraction in one group, it is known as the sign test. Shabash. And if I'm comparing percentage of fraction in 2 groups or more than equal to 2 groups, it is known as the chi-square test. Okay. Jaldi se now. I'm giving some examples. First is, I am having one ward. This is my ward. इसमें the average BP value of all my patient is 120/80. ठीक है? Before giving a drug. After giving a drug, their average value of BP is 100/70. Now I am comparing what? I am comparing average value. Average value is nothing else but mean. So I am talking about which test? Parametric test. No issues with this. I am comparing this average value or mean value in how many groups? One group. Only before giving a drug and after giving a drug. Group कौन सा था मेरा? Group same ही है. So if I compare the mean or average value in single group, answer should be paired student t-test. Next, I have ward A and ward B. Ward A का average BP is 120/80 and ward B का average BP is 140/90. I am comparing what? Mean or average value. कितने groups में? Answer should be unpaired student t-test. Next is I am having ward A, ward B, and ward C. Average BP value of ward A is 120 by 80. Ward B it is 140 by 90. Ward C it is 100 by 70. I'm comparing which value? Average value or mean value. In how many groups? Three groups. Answer should be ANOVA test. Next, I'm saying that in my ward, ward A, एक ही ward है मेरे पास. In my ward A, there were 40% hypertensives. But after I gave a drug, there are only 20% hypertensives. What I'm comparing? Percentage. If I'm comparing percentage, these are non-metric tests. In how many groups I'm comparing it? One group. Bus before giving a drug and after giving a drug. So answer should be sign test. And if I say ward A has 40% hypertensives and ward B has 20% hypertensives, what I'm comparing? Percentage. In how many groups? Two groups. Answer should be chi-square test. That's it. ठीक है? So जल्दी से अभी आंसर बताओ. What we are comparing over here बच्चों? Percentage. So it should be parametric or non-parametric. In how many groups we are comparing? कौन सा दो ग्रुप दिख गया तुम्हें? In single group, same group, just before giving a drug and after giving a drug. Answer should be sign test. Shabash. Question number 69. An ophthalmologist prescribed myopic glasses to a patient who was unable to see distant objects. The level of prevention in this case will be. Very good. There are 4 levels of prevention. Primordial is before risk factor. Risk factor now there will be, if we do, it is primordial level of prevention. It is done by health, education. Next is primary level of prevention. It is done when the risk factor is present, but the disease is absent. Okay. It is usually done by health, promotion, or second is specific protection. Next is secondary level of prevention. It is done when the disease is already started. Therefore, can we do anything for prevention? No. Therefore, we will do for early diagnosis and treatment. So all screening tests, all diagnostic tests, all treatments will come in secondary level of prevention. Next, tertiary level of prevention. It is done when the disease is in progression or it is already over. Okay? It is already completed now. Disability or complications have occurred. Now what I'll try to do, जो disability हुई है मैं उसको क्या करूंगा? I'll try to limit that disability. That's the disability limitation. And second is rehabilitation. ठीक है? At least I'll try that I shall limit his complication or I shall limit his disability so that he can go to work. That is rehabilitation. तो जल्दी से बताओ, यहाँ पे you are giving myopic glasses. Myopic glasses, will they treat myopia? No. If they are not treating myopia, can they be secondary level of prevention? No. They are only helping the patient to see better. That is disability limitation. They are limiting the disability of the patient. Okay. And they are also helping to see him better and so he can get a job. That is rehabilitation. So it is which level of prevention? Tertiary level of prevention. Either disability limitation or rehabilitation. No issues with this, anybody? All contraceptives are primary level of prevention, specific protection, except COCPs used in PCOD, secondary level of prevention. COCPs used in endometriosis because they are used for treatment. Next, all vaccines are primary level of prevention, specific protection, except, very good, BCG vaccine in bladder cancer because it is used for treatment. Crutches in are tertiary level of prevention. Intraocular lenses, secondary level of prevention. Why? Because intraocular lenses are used for cataract surgery. They are used for treatment of cataract, right? Normal contact lenses की अगर मैं बात करूं, get it right. Contact lenses, tertiary level. Intraocular lenses, secondary level. Okay, no issues with this, anybody? That's important. ठीक है? Source reduction of mosquito, primary level of prevention. ठीक है? Spraying of insecticide, primary level. Mosquito nets, mosquito repellents, primary level. No issues with this. Use of mask, primary level. Promoting the use of mask, primary level, specific protection. Okay, yeah, so primary level health promotion. जब promotion आता है नाम में, तो please mark it as health promotion and not specific protection. Question number 70. A multi-purpose worker male prepares malarial slides in an endemic zone. These slides will be examined at which level? Multi-purpose worker male is located at which level? Sub-center. but he prepares it at level of sub center, but PHC पे जाके examine होते हैं. So malarial slides are usually examined at the level of PHC. Multi-purpose worker male goes for a house-to-house visit every 14 days, every fortnightly, na? And any person who is having a fever, he takes a blood sample and makes a peripheral blood smear of it to look for malaria in the patient usually. No issues with this, anybody? Jaldi se important wale batao. CHC is Community Health Center. Number of staff is 46 to 52. Healthcare worker who is located is known as Health Supervisor. One CHC per 1,20,000 population in plains, but one CHC per 80,000 population in hilly or tribal areas. PHC, Primary Health Center, number of staff are 13 to 21. The healthcare worker is known as health assistant. Okay, one PHC per 30,000 population in plains and one PHC per 20,000 population in hilly or tribal areas. Subcenter now. The number of staff are 3 to 4. The healthcare worker at subcenter, multi-purpose worker, male and female. If multi-purpose worker female nahi hai, uski jagah ANM can take, that is auxiliary nurse midwife. One subcenter per 5,000 population in plains and one subcenter per 3,000 population in hilly or tribal areas. Village level, the first healthcare worker, most important, ASHA worker, full form of ASHA, accredited social health activist. Previous year question, accredited social health. She should be a young female, 25 to 45-year old. She should be resident of same village. She should be elected by the village or gram panchayat. She will be accountable to village and the gram panchayat. She is a member of village health and sanitation committee. As she is a member of sanitation committee, one role of her is also to promote the construction of household toilets as well. She promotes institutional delivery. She will take the female for delivery into the hospital, but she never conducts a delivery. That was a previous year question. Which among the following is not a responsibility of ASHA worker? Answer is conduction of delivery. It is done by multi-purpose worker female or auxiliary nurse midwife with the help of traditional birth attendant, but never ASHA worker. Okay, so that is important. ASHA worker also works as a DOTS provider for TB treatment or ATT के लिए. ठीक है? ASHA worker, what is the population norm now? 2 ASHA worker per 1,000 population. Next is at the village level, second healthcare worker is known as village health guide. One village health guide per 1,000 population. And last is TBA, that is traditional birth attendant, also known as your trained dai. One dai for 1,000 population. Last is Anganwadi center. Who is located at the Anganwadi center? Anganwadi worker. One Anganwadi per 400 to 800 population in plains, but one Anganwadi per 300 to 800 population in hilly or tribal areas. No issues with this. What is the qualification required for ASHA worker? 10 pass. But minimum qualification if they ask, 8 pass. ये previous year question था. I always say recommended qualification is 10 pass. But अगर उसके गांव में कोई 10वीं पास है ही नहीं, तो क्या करेंगे फिर? Minimum qualification is 8 pass. Okay. For multi-purpose worker, the qualification is 12th pass. For multi-purpose worker, it is 12th pass. Anganwadi worker, 10th pass she should be. ठीक है? Then village health guide, 6th pass. Traditional birth attendant, सब आता उसको. तुम सिखाने जा रहे हो. ठीक है? तो please remember that. No issues with this, anybody? What is the best indicator of ASHA's performance? Very good. Decrease in the infant mortality rate. Other indicators are decrease in the protein energy malnutrition rate. Next is number of TB cases detected or the number of leprosy cases detected. But major impact indicator is always decrease in infant mortality rate, because that will tell वो postnatal visits पे जा रही है या नहीं जा रही है. ठीक है? How many postnatal visits by ASHA worker? 6 to 7. Home delivery 7. Hospital delivery 6. And by MPW female or ANM 3 to 4 usually. Last visit is on day 42. because maternal death is the death of the mother during pregnancy, during labor, during delivery, and after 6 weeks of delivery. Maternal deaths के लिए the timeline is 6 weeks. PPH का तुम्हारा 12 week है. But usually for maternal deaths, this was the previous year question. 6 weeks ही है बच्चों maternal deaths के लिए timeline. A child was suffering. Okay, a child was suffering from abdominal pain with sausage-shaped lump and red currant jelly stools. Classical. Sausage-shaped lump and red currant jelly stools are suggestive of which disease? Intersusception. And the child has a history of recent vaccination. Which among the vaccine is most likely to be associated with the condition? Intersusception is usually due to a vaccine which causes diarrhea, that is known as rotavirus vaccine. If rotavirus vaccine is not given in time, it can be given up to maximum. This was a previous question. 12 months or 1 year of age usually. DPT vaccine can be given up to 7 years of age. Measles vaccine can be given up to 5 years of age. OPV vaccine can be given up to 5 years of age. Please remember, hepatitis B vaccine can be given up to 1 year of age. Okay, important. Hepatitis B birth dose can be given up to, very good, within 24 hours of birth itself. And OPV zero dose should be given up to within 15 days of birth. Please remember, दोनों का आंसर अलग अलग है. Please remember that. Okay. Measles associated with which adverse events following immunization? क्या क्या होता है measles vaccine की वजह से? The patient causes toxic shock syndrome. The patient will have decreased platelet count, that is thrombocytopenia, and the patient will have febrile seizures. Okay, please remember that. Fever is a side effect associated with pertussis, persistent inconsolable crying. Again, pertussis. Please remember, lymphadenopathy and osteomyelitis, BCG, shock and hypersensitivity, hepatitis B. Okay, so that's important for you to remember. The bacteria will be uniformly stained in which phase of the given bacterial growth curve? There are 4 phases of the bacterial growth curve. First is called as the lag, second is called as the log, third is the stationary, and fourth is the decline of the dead phase. So क्या होता है lag phase में? Usually lag phase में there is no cell division. Here the bacteria is trying to adapt to the new environment. He is metabolically active, मतलब he is preparing for cell division. ये क्या कौन सा phase होता है? Preparation वाला phase होता है. Next is the log phase. Log phase में क्या होगा? Exponential growth होगी. A lot of cell division will occur, and this is the most metabolically active state. Previous year question. ठीक है? Important. Next stage is what? Stationary stage. Stationary stage में क्या होता है? Growth rate is equal to the death rate. That means the number of bacteria will be constant or stationary. Okay? And now, therefore, the toxins will start collecting inside the bacteria. And finally, what will occur? Decline or the death phase, when the bacterial cells will start declining. Important is easy. किसी को नहीं समझ में आ रहा तो सबसे पहले तुम जब आते हो गौतम नगर तो क्या किया तुमने? You are in the lag phase. You try to adapt to the new environment. Then you are in the log phase. तुमने बहुत ज्यादा पढ़ाई कर ली, बहुत ज्यादा. There was a exponential growth. Okay, so that is the log phase. And then पता चला कि कोई बंदा या बंदी मिल गई. Then क्या हो गया? वाट लगने की शुरुआत. That is the stationary phase. And finally क्या हुआ? एग्जाम में खत्मा. That what happens. This is the normal growth curve of Gautam Nagar. अब तुम्हें देखना है कि तुम्हें इसमें फंसना है, यहां से ऊपर जाना है. So that you need to decide for yourself. चलो. Important is, चलो बताओ. So uniform staining will occur in which phase of bacterial growth curve? It will occur in the log phase. When there is exponential growth, please remember there will be uniform staining of the bacteria itself. ठीक है? So that's important. Question number 73. इतना ही क्वेश्चन आया है. 2 क्वेश्चन आए हुए हैं. मोस्ट मेटाबॉलिकली एक्टिव स्टेट लॉग फेज, यूनिफॉर्म स्टेनिंग लॉग फेज, दोनों लॉग फेज में. और नीट पीजी में ये क्वेश्चन था, ग्रोथ रेट इज इक्वल टू डेथ रेट इन स्टेशनरी. वो तो नाम में ही है सब कुछ. क्वेश्चन नंबर 73. A 10-year-old child with severe abdominal pain, perianal pruritus, that is itching in the perianal region, is auto-infected. Auto-infected मतलब he is itching in the perianal region, and वही हाथ काट डाल रहा है वो वापस मुंह में डाल रहा है, दैट इज व्हाट इज ऑटो इन्फेक्शन. आइडेंटिफाई द ऑर्गेनिज्म फ्रॉम द गिवन इमेज. हद यार. ऑफ स्कॉच टेप मेथड डेमोन्स्ट्रेशन. जो हंस रहा है ना आधे तो उसी में से करते होंगे. चलो ये बताओ भी. नाउ व्हाट इज दिस, क्या दिख रहा है? एक तरफ से एग प्लेन है, दूसरी तरफ से एग कॉन्वेक्स है. So this is called as plano-convex egg. And this plano-convex egg has what inside it? It has this. क्या दिख रहा है? कौन से लार्वे दिख रहे हैं? टैडपोल लाइक लार्वा दिख रहा है ना. लार्वा इज नथिंग, इमेच्योर फॉर्म, बट याद रख लो. तो प्लेनो-कॉन्वेक्स एग एंड टैडपोल लाइक लार्वे यूजुअली, ये एग्स बहुत इंपॉर्टेंट है हेलमेंट्स के. किस में दिखता है? Very good. Enterobius vermicularis, also known as pinworm, threadworm, seedworm, all of that. ठीक है. Hymenopsis nana, इसके एग पे ढक्कन होता है. That is called as a operculated egg. And Hymenopsis nana is also known as dwarf tapeworm, क्योंकि सबसे छोटा tapeworm होता है ये. Okay. So these are the, ये सब screenshot micro FMG snaps 1 से है end में. ठीक है. So this is Diphyllobothrium latum. कौन सा टाइप का एग? ढक्कन है मतलब operculated egg. Diphyllobothrium latum is also known as fish tapeworm because the definitive host is fish, and it leads to which kind of anemia? Megaloblastic anemia. Next is Hymenopsis nana. Okay, it is also known as dwarf tapeworm. Which kind of egg? Non-bile stained egg, and that will also cause auto infection. Next is August 2020 question. What is seen? Mucus plugs are seen on both sides of the egg, giving which characteristic appearance to the egg? Barrel-shaped egg or dumbbell-shaped egg. That is the egg of Trichuris trichura, also known as whipworm. It causes infection in the large intestine, and recurrent infection or recurrent infections will lead to rectal prolapse, causing coconut cake-like rectum. Okay, that is known as Trichuris trichura infection. Next is important, X of schistosoma. Okay, the one schistosoma which does not have any spine. If there is no spine, that is schistosoma japonicum. No spine is schistosoma japonicum. Terminal spine is schistosoma hematobium. Terminal spine is schistosoma hematobium. Lateral spine is schistosoma mansoni. So lateral spine is schistosoma mansoni. At least 3 important. Schistosomiasis in a patient, urinary bladder schistosomiasis causes which cancer in urinary bladder? Previous one. Normally common is transitional cell carcinoma, but in a patient of schistosomiasis, squamous cell carcinoma of urinary bladder is common. We discussed in surgery, right? Next important, क्या दिख रहा है? Eggs are having these. What are these? Blastomeres. So eggs with blastomeres are seen in which organism? Ankylostoma duodenale. Ankylostoma duodenale is also known as hookworm. It causes ground itch. It leads to iron deficiency anemia because Ankylostoma duodenale is a blood sucking organism. ठीक है. And hookworm eggs per gram of stool is known as which index? 3 बार का क्वेश्चन है PSM का. Chandler's index. When is Chandler's index, like at what cutoff we can consider that hookworm infection has become a social or a public health problem? If the Chandler's index is more than 300. If the Chandler's index is more than 300, that is suggestive that this hookworm infection is a social or a public health problem. Okay, X with blastomeres, I've told you. Now, important is Ankylostoma duodenale can penetrate. Okay, but Ankylostoma brasiliensis could not penetrate, and therefore it remains trapped in the skin itself, and that causes cutaneous larva migrans. Just image and causative agent was asked. Okay, this is nothing but cutaneous larva migrans. Causative agent is Ankylostoma brasiliensis. And the most common worm infection is Ascaris lumbricoides, leads to ascariasis. Okay? No issues with this, anybody? And lastly, the plano-convex eggs, as I've told you, Enterobius vermicularis, pinworm, threadworm, seedworm, perianal pluralitis, autoinfection. Got it? Snaps में क्यों जरूरी है snaps पढ़ना? If I have worked hard on it, मैंने उस टाइम यही सोचा था कि if somebody opens the snaps, definitely they should revise everything that about that particular topic. That is my way of studying. So that is how you can study easily with snaps itself. Okay, so it is non-bile stain plano-convex eggs along with a tadpole-like larvae. ठीक है, चलो. Question number 74. 75 कर लो फिर ब्रेक ले लो. A gardener presents with subcutaneous lesion on the hand, which he thinks resulted from the wound he received while he was making a frame for floral red. Floral red मतलब he was working with flowers. ठीक है? The nodule has ulcerated and not healed despite the use of antibacterial cream. क्यों नहीं heal करी? Even though he is very good. Because it is a case of fungal disease, therefore it will not respond to antibacterial cream, which is the most probable diagnosis. Very good. क्या बोला जाता है इस डिसीज को और? Rose Gardner's disease definitely. ठीक है? Usually it is due to thorn prick injury. Okay, it is due to thorn prick injury. Usually seen around Valentine's Day or when the person is walking barefoot in the Himalayas. Okay, that will be the characteristic history which will be given to you. The causative agent is Porothrix skenki, which is a dimorphic fungus. It can exist in yeast form as well as mold form. Yeast form shows with shape, cigar shape, and mold form shows flower like sporulation. ये image आ चुकी है एग्जाम में, ठीक है? Please remember. And it leads to sporotrichosis या Rose Gardner's disease. It not only leads to a skin lesion, but can you see that the skin lesion is spreading along the lymphatics? जैसे जैसे lymphatics होंगे वैसे वैसे ये spread होगा disease. So cutaneous, sorry, it is a sorry lymphangiocutaneous disease. Okay, this condition. That is what is sporotrichosis. Which kind of bodies are usually seen? Very good. Asteroid bodies. But copper penny bodies or medlar bodies. Very good. So these copper penny bodies or medlar bodies, also known as globosclerotic bodies, are seen in chromoblastomycosis. Sarkari question exam का तुम्हारे. ठीक है? Please remember this. No issues with this, anybody? Next important is histoplasma capsulatum. Histoplasma capsulatum causes histoplasmosis, also known as which disease? Darling's disease. Please remember, this disease will look like exactly like TB, tuberculosis. It is due to exposure to pigeon dropping. Okay, so that is important. और ये सबसे important question जो repeat होता है. There are 3 species of dermatophyte. First is trichophyton. Second is epidermophyton. Third is microsporum. Trichophyton मतलब it will infect skin plus hair plus nails. तीनों को infect करता है ना tricho. It will have which kind of macroconidia? Cylindrical macroconidia and many small microconidia will be there. Next is epidermophyton. Epidermo मतलब skin and N हाथा है मतलब nails. So it will only involve epidermophyton only involves skin and nails. Which kind of macroconidia? Club or boat shaped macroconidia without any microconidia. And last is which shape of macroconidia? Spindle shape of macroconidia with very few microconidia. This is known as microsporum. तो अब स्किन तो हमेशा इन्वॉल्व होगी. ओके, सो डेफिनेटली यहाँ पे एन आता है क्या? नहीं, तो नेल्स होंगे इन्वॉल्व, तो सॉरी हेयर होंगे इन्वॉल्व. ठीक है, नो इश्यूज विद दिस एनीबॉडी? दैट्स इंपॉर्टेंट. व्हाट इज द ड्रग ऑफ चॉइस फॉर स्पोरोट्राइकोसिस? जल्दी से बता दो. वेरी गुड. द ड्रग ऑफ चॉइस फॉर स्पोरोट्राइकोसिस इज itraconazole. Please remember, it is itraconazole. Question number 75. Mark the correct statement among the following with the help of the given image. What is this? अरे है क्या इमेज, ये बताओ तो सही. Is it a dose response curve or it is a log dose response curve? Very good. Dose response curve का shape. Dose response curve का shape. शाबाश. Rectangular hyperbola. Dose response curve का shape is rectangular hyperbola. Log DRC, log dose response ka shape is definitely sigmoidal or S shape. It is sigmoidal or S shape. Important is three things you need to see. First of all, you need to check for the potency of the drug. Potency is nothing else but power of the drug. Okay? Next, you need to check for efficacy of the drug. And third, you check for safety profile of the drug. Important is potency or power of the drug is decided by the side of graph. That means which sided graph will be more potent? Shabash. Left-sided graph will be more potent as compared to the right-sided graph. Efficacy is determined by the height of the graph. जिसकी ज्यादा height वो drug ज्यादा efficacious. And lastly, safety of the drug is determined by slope of the graph. Safety of the drug is determined by slope of the graph. If the graph is having steep curve, the drug is safe or unsafe? Unsafe drug. Very good. Because it will immediately escalate from therapeutic level to toxic levels. Okay? But if it is having a flat curve, then it is a safe drug. It is a safe drug. Now we need to discuss about these things. सबसे efficacious drug कौन सी लग रही है? X usually. ठीक है? X is the most efficacious drug. Most potent drug कौन सी लग रही है? X again because it is on the extreme left and Z is the least potent drug. Least efficacious drug कौन सी है? Y because it is having the lowest height. Now option A says drug Y is more efficacious than drug Z. No, because it is having a low height, it is not true. Drug X is more potent in comparison with drug Y and Z. Yes, that's a true statement. The most potent among all of them is drug Z. No, that is the least potent one. The answer is option B. Take a break. Then we'll meet after break.